Hello friends, welcome to this lecture. The 13 Principles of GCP or Good Clinical Practice. If you can remember, Nuremberg was just 10, but now we got 13, right? So the first one is GCP works according to the principles set up in the Code of Helsinki. So you can imagine as if the code was planted and cultivated during the time of Helsinki, right? With care and affection. And now the full-blown GCP, the fully mature GCP, works in accordance with the principles that we started at Helsinki. And the second one is very important. The trial is initiated and continued only if the benefits for the subject and society is more than the risk and inconvenience caused. So this this cute little doggy is like a class act clinical trial investigator. He really knows how to keep the benefit for the subject, for the human subject and society, more than the risk and inconvenience. And this is very important. So the benefit for the subject is given precedence over society. So why is this important? If you remember, during the Nuremberg trials, Karl Brandt, Adolf Hitler's personal physician, he said any inconvenience or damage done to the subject is rationalized and justified because he thought that he's doing good for the society. His logic was fully flawed and it was unscientific, but even so, we have to give precedence to the subject because the subject is under the care of the physician. The subject has given his heart and soul to the doctor and the trial team and to everybody. So we have to give precedence to the subject because the subject is under our care, right? The society should be taken care of too, but then the society is not directly under our care. The society is so big, so the subject is always given precedence over society, and not just society, it's given precedence over science too. You cannot say you're doing it for the advancement of science, like what Karl Brandt said. So the subject is given precedence over science and society. And then non-clinical and clinical information supports and justifies the trial. So if it is a phase 1 trial, all the animal data shows that the drug is effective and it is safe, it doesn't cause too many adverse events in the animal models, and effective as in using the animal models of disease, you have shown that it might possibly treat this disease. Then only you can go into phase 1. If it is phase 2 or 3, the preceding trials must have shown promise. It must have shown that the drug works and it is safe, it doesn't have too many adverse events. So the trial needs to be supported by prior clinical and non-clinical information. And then the clinical trial should be described in a detailed and clear protocol. Why is this important? Because the trial is done by many doctors all around the world and it's analyzed by many data managers, and drug is administered by many dispensed by many pharmacies, and it's run by a whole team which is distributed all around the world. So they need to have a central document which highlights and shows exactly what to do, how to do it, when to do it, how to enroll subjects, what is the eligibility criteria, what assessments to do, which labs to do, how to consent subjects, and when to withdraw the subject. Everything needs to be detailed in the protocol, clearly detailed, crystal clear protocol. And then this protocol, that's good, the protocol is there, but each hospital or clinic, they have responsibility to their subjects, right? So they have to evaluate the protocol and see whether it's suitable for their subjects, for their patients. So this is done by the ethics committee. So ethics committee is an independent body of individuals who are doctors, scientists, lawyers, and lay people who evaluate the protocol for the science, for the ethics, and in terms of the subject rights, and see whether it's suitable for their subjects. And if they're happy, they give the seal of approval, and only if they approve, we can you implement that protocol in that hospital. And then this is very important, medical care is given by a qualified doctor, or if it is a dental trial, by a qualified dentist. So in many countries you have this thing called medical registration. the medical registration lasts for a few years and it expires and you need to renew it again. So as CRAs, we have to look at the PIs and the sub-investigators medical registration and whether they have the current medical registration. So medical care, that means treating the subjects, prescribing the drug, and all medical related decisions are taken by qualified doctor or a dentist. In some countries, even informed consent should be done by a qualified doctor. Why is this so? It depends on the country, and in some countries a coordinator or a nurse can do it too, but medical care should be given by a qualified doctor or a dentist. And that's not all. The whole team needs to be qualified. The sub-investigators, pharmacists, coordinator, nurse, everybody needs to be qualified in terms of education, training, and qualifications. So education, you can look at the CV. Study related training, we are supposed to deliver as CRAs. We train the team and then we record that they are trained, and then we train them for GCP too. So GCP says they should be trained on GCP. That's one of the principles of GCP. So they need to be qualified by experience. So if it is a specialist doctor, they need to have experience in that specialist area, right? So that we can take care of by looking at their CV, current CV. And then freely given informed consent is taken from each subject before any study related procedure is done. Even drawing of blood, even before that, we take the informed consent. What does freely informed mean? That means the subject is given a copy of the informed consent, and the doctor or the physician explains every detail in the informed consent. What are the responsibilities of the trial, what assessments are done, what are the risks and benefits, what are any adverse events that might happen, and that the subject has the right to withdraw anytime they want, any remuneration provided, everything explained, and then the subject is given enough time to reflect upon it and ask questions. And if they ask the question and the doctor answers and the subject is happy, then only we sign the consent, and that is called freely given informed consent. And then the trial is done, you do the assessments, you collect the data. There's a rule about data too. Data is recorded and stored in such a way that it allows accurate reporting and verification. What does that mean? Each data point has an audit trail. It shows who recorded it, at what time, and if it was changed, why it was changed, how it was analyzed. Everything is recorded in such a way that it allows verification and accurate reporting. That means it gives the ability for the data to come under a magnifying glass and come under scrutiny to verify and validate that it is true, it is in fact real. And the confidentiality of records, this is very important. In many countries, in almost all countries, the name or the identity of the subject cannot be revealed to external parties. It cannot be transmitted out of the hospital or the clinic. So as CRAs, we'll go to site and we'll see the name of the subject, but we are not supposed to make copies of that and transmit it elsewhere, right? If we do, we need to block the name. We need to obstruct it. So in some countries, even date of birth cannot be transmitted. So this all works according to the Privacy Act in that particular country. In the United States, it's called HIPAA. So you have to look at the privacy laws in your own country and see what rules are to be followed. But confidentiality and subject identity needs to be protected. And there's a rule about drug manufacturing. So the IMP, or investigational medical product, is manufactured and stored according to GMP. So GMP is like the cousin of GCP. It's called Good Manufacturing Practice. It shows exactly how to manufacture it, store it in such a way that it ensures the quality of the drug. So we are going to details of GMP because that is for the manufacturing people. And also after manufacturing, drug has to be used in accordance to the protocol. What dosage to give, how it is to be stored, and that sort of thing. And even how it is to be destroyed. Everything is given in the protocol, right? So it is to be used in accordance with the protocol. And then to make sure that all these principles work in harmony, there should be a system of procedures that ensure the quality of every aspect of the trial. So this is a nice picture. You can think of that powerful man with the suit like CRAs, right? We are making sure the whole system goes according to plan. To be truthful, we don't have so much power. We just work with the doctors and the nurses and the pharmacists and data managers and everybody to make sure the trial goes in harmony and quality of the trial is maintained. So we are like the communication link between each of these groups. So you can think of a better analogy will be we are the lubricant which makes sure that each wheel smoothly transmits value and data to the next wheel, and make sure that the trial is done in sync, in harmony, and quality of every aspect of the trial is maintained. So those are the 13 principles of good clinical practice. I hope you understood and appreciated it. So these are not just words, think of the meaning behind it. And last not but least, I want to make sure, did you print copy of the GCP? Make sure you print it now. You print it now if you haven't, okay? Look at the 13 principles in your GCP booklet. Underline them and write your own notes about your thoughts, how it impacts, because these are not just words. Try to understand it and take it to your heart and your mind, right? This is very important. Next, we'll look at, who are the key players in GCP, good clinical practice, what are their responsibilities, and the operational aspects of the GCP, how we do these things, right? These are the principles, but how do we implement it? That's very important. But for now, master the 13 principles of GCP. And hope to see you in the next lecture.